Hi, I'm Dr. Les Feinberg, developer of neuromodulation technique, the Feinberg method, NMT for short, and in the next few minutes I'll give you an overview that will help you to understand what NMT is and how it works. Then you can select from more in-depth discussion and demonstration videos on our website that you find of interest. NMT is one form of complementary medicine. Complementary means serving to fill out or complete, mutually supplying each other's lack. So NMT provides what conventional medical care does not, a way to unlock the mind-body's innate healing powers that have somehow been blocked. There are many types of complementary medicine, including nutritional supplementation and diet, acupuncture and bodywork, massage, chiropractic, osteopathy, psychology, counseling, many more. But NMT is a special area of complementary medicine referred to as energetic medicine, consciousness medicine, or the term that we think best describes NMT, informational medicine, because NMT examines and corrects the informational basis of illness and failed healing. Because it is informationally based, NMT is inherently non-invasive and safe. NMT looks at healing from a holistic perspective. We see the patient not as a body with a mind, but as an integrated mind-body. The foundation of NMT is precisely structured and effectively directed therapeutic intention between the NMT practitioner and patient. The reason that this kind of communication is even possible has to do with what is called quantum entanglement, and it's based on the principles of quantum physics developed over the past 100 years and mathematically proven by physicist John Stuart Bell in 1962. This is the understanding that the universe at all levels of organization is non-local. Non-locality means that although we perceive the world as composed of things, including ourselves, that seem to be separate, isolated, and distinct from one another, that the universe at its most fundamental and subtle levels is in truth undivided, without actual separation, and it is informational in its essential nature. An experimental demonstration of this entanglement that I spoke of is reported by physicist Dean Radin in his book Entangled Minds. He describes an experiment in which pairs of research subjects were brought into the laboratory, and each was fitted with an EEG apparatus to show their brainwave patterns. Not surprisingly, these patterns were different from one another. The subjects were then asked to meditate together, and within about 15 minutes it was noted that their brainwaves came into a synchronous pattern, evidence of quantum entanglement, producing a linking between their nervous systems. These subjects, still fitted with the EEG apparatus, were then separated and each put in a Faraday cage room to filter out any possible electromagnetic communication between them. The rooms were then light and soundproofed. Only one of the pair of subjects was then exposed to a flashing strobe light that produced the expected brainwave activity in the visual cortex of the brain corresponding to this light stimulation. What's amazing about the experiment is that their partner, isolated away in the sealed room, demonstrated exactly the same brainwave patterns at exactly the same time, having never been exposed to the strobe light. This property of entanglement is what makes possible the NMT system of healthcare based upon therapeutic intention between the NMT practitioner and patient. A core NMT principle is the understanding that no body activity or function is random. Whether it contributes to wellness or it contributes to illness, every activity the body does is always the physical level expression of a set of instructions that exist at an informational level in the mind-body. Healing and wellness require the integrated function of all of the body's 50 trillion cells. Healing requires that the informational state of the mind-body reflect an accurate awareness of the body's internal conditions and be free of confusion and error. Otherwise, the mind-body becomes confused and inefficient. For example, when the immune system produces a self-destructive allergy response to something benign, like a food or the pollen of a flower, or it persists in a state of chronic pain long after an injury. NMT is uniquely effective because NMT uncovers the informational basis of blocked healing and disease, and it produces a more complete and accurate self-awareness of conditions in the mind-body needed to best regulate its function. The components of the NMT system are what we call NMT clinical pathways. These are carefully crafted sets of investigative statements that determine the mind-body's perceptions of its internal state, and corrective statements that retrain the mind-body to more accurate self-awareness, resulting in better biological function. The 70 or so NMT clinical pathways give an unmatched informational depth and power to the NMT system. What does the NMT session look like? Well, the NMT practitioner typically takes a detailed health history and interviews the patient to fully understand their situation and NMT treatment objectives. Muscle response testing or other energetic testing is used to directly monitor body responses to our NMT evaluation. The NMT practitioner and patient may work in any variety of different positions or postures, and nearly any muscle can be used to monitor the mind-body's responses. This is all really just a matter of convenience and preference for the NMT practitioner and their patient. As the NMT session proceeds, our highly structured NMT system evaluates the mind-body's perceptions of its internal state to uncover the informational basis of illness and blocked healing. Special testing ensures the selection of NMT pathways that are of the highest priority and most value to induce healing. One after another, we apply all of the NMT clinical pathways that the mind-body recognizes are needed for that particular NMT session. Responses to NMT are typically rapid, and in many cases, like chronic pain and allergies, may be immediate and profound. Long-standing conditions that have not responded well to other health care reasonably require NMT care over some period of time. Typically, the NMT practitioner will use special energetic testing to determine the frequency and the duration of care to produce the best and the most lasting results. The best responses to NMT happen when the patient and the NMT practitioner have a therapeutic relationship based on openness, trust, and mutual understanding. After the initial NMT evaluation, they should discuss and they should come to an agreement on an NMT treatment plan that strikes a balance between the patient's healthcare needs on the one hand and time and cost considerations on the other. Usually, we suggest a therapeutic trial of some number of NMT sessions that seem appropriate for that patient. This allows us to advise the patient based on their actual clinical response to NMT instead of guesswork or some one-size-fits-all approach. For some patients, we may recommend just a couple of NMT sessions. For someone who has serious chronic disease that has been unresponsive to conventional healthcare, this therapeutic trial may be 8 to 12 sessions. The NMT practitioner measures progress during every NMT session, and we correlate this with the improvement that the patient perceives. This allows us to move forward on a rational and sensible basis toward the patient's health goals. NMT is often effective in cases where nothing else has produced a satisfactory response. The reason that this is possible is the careful structure and the informational depth of the NMT system, which allows us to get to the heart of the matter and to release and redirect blocked mind-body resources to produce optimal healing, growth, and transformation toward the desired clinical outcome. You'll find a growing number of educational video and text resources and interactive forums on our NMT website to help you better understand NMT. Whether you're a prospective patient in need of NMT care, a healthcare practitioner interested in studying NMT to provide your patients with the most effective care you can bring them, or an individual who wants to learn NMT to heal yourself and your family, you'll find valuable resources and discussion forums on the NMT website.